Several health experts in the Caribbean agree that while COVID-19 vaccines have very rare side effects, they still prevent the risk of hospitalization and death. They say the vaccines produced are inherently safe, quoting the UK as an example in the complete turnaround that country has faced since vaccinating over 70% of the population. And now with spiraling death rates in India, they believe it's even more critical that vaccinations occur sooner rather than later. Sunil Lalla reports.
They should actually be looking at the news and seeing what's going on in India. You know, it's an indulgence to talk about these conspiracies, you know, when thousands of people are dying every day from COVID. You know,
a frustrated Professor Clive Landis on the infodemic that he says has made the pandemic even worse and possibly delayed persons from getting vaccinated. Professor Landis, who heads the UAE's COVID-19 task force, says conspiracy theories has caused many not to trust the various vaccines available despite its effectiveness and safety. He points out that the UK, which is also using the AstraZeneca vaccine, had around 1,200 deaths daily in January and is now down to less than 10 a day after vaccinating 70% of the population. This, he says, is in comparison to what is currently occurring in India, where there is hospital overcrowding and mass funerals. Professor Landis says many believe the AstraZeneca vaccine is inferior since it costs around $2 compared to $30 for others, but explains why it's inexpensive.
People were saying, well, maybe it's not such a good vaccine, it's so cheap. But that's because the company said, we're not going to make money off it. This is meant to be to vaccinate the world. And so, you know, I think they have behaved very ethically.
Meanwhile, Dean of the Faculty of Medical Sciences, Professor Terence C. Mungle, acknowledges that the AstraZeneca vaccine can cause blood clots, but says it's estimated at 4 cases per million. He adds that people engage in much more dangerous activities without even a second thought.
The death rate is estimated at 5.3 per million, but we go in aeroplanes. So what I'm saying is, yes, there is the possibility of a very rare disorder, but it is just that, very, very rare.
And with variants circulating the globe, Professor Landis says vaccinations could help stop new variants from popping up.
The worst situation is to have someone who is on ICU for a long, long time, very, very gravely ill with a suppressed immune response. And persons like that will be generating variants within them.
Professor of Molecular Genetics and Virology at the UWI St. Augustine campus, Christine Carrington, admits that there's a slight drop-off of efficacy in protection against some variants, but it still provides sufficient protection.